Hi, I'm Dr. Astha Dayal and I'm the lead consultant gynecologist with CK Birla Hospital in Gurugram, and today we're going to discuss about pelvic floor dysfunction. Now, what are the causes of pelvic floor dysfunction? So the most common cause is childbirth. Whenever there's a delivery through the vagina, it leads to some stretching and strain on the pelvic floor muscles, and this usually causes pelvic floor dysfunction. Another common cause is age. As we age, after menopause, the hormonal deficit leads to laxity of the muscles, and it also causes the lining of the vagina to become thin, which can cause urinary problems. Now, besides this, anything which puts pressure on the abdomen, like chronic cough, constipation, obesity, all these things, heavy weight lifting, they can cause the pressure going down, and that is why there is a problem of prolapse, which means something coming down when you strain in your abdomen. Besides this, if you've had any trauma in that area or any pelvic surgeries, they could also be a cause of pelvic floor dysfunction. So how do we treat pelvic floor dysfunction? The first change that we must do is lifestyle modification. In lifestyle modification, you have to improve on your diet. You should avoid alcohol and smoking, and you should avoid caffeinated drinks. There are certain foods which start irritating the bladder wall, so you should avoid them, like spicy food, citrus foods, too much of sugary food you should be avoiding. The second thing is weight loss. There are a lot of studies that have shown that if a woman loses 3 to 5% of her body weight, she actually cures her urinary incontinence. So the urine leak issues get better if you reduce your weight. The third thing is exercise, which means that you should do a specific form of exercise called Kegel's exercise, which we teach you after your delivery, which is the vaginal tightening and the pelvic floor tightening exercise. And you should also do core strengthening exercises so that your pelvic floor muscles are strengthened. The next treatment that we could use is some medication. We can use some medicines for overactive bladder, which means that if you have the problem of urgency and frequency in urination, it can be treated with some medication. Also, after menopause, if you have problems of that urinary sensation happening again and again, or pain during vaginal intercourse, then we can give you some estrogen creams. Besides this, there can be certain conservative things that we use. For example, we can use pessaries if you have a problem of prolapse, so the vaginal and the tissues are coming down, we can support it with a local pessary. Then physiotherapy is a very important treatment for pelvic floor disorders. There are certain exercises like Kegel's exercises, pelvic floor muscle strengthening exercises that we suggest, but you could do them in a guided way along with physiotherapy. We actually call this process called biofeedback. So in biofeedback, the physiotherapist guides you and you know how to relax that certain group of muscles or contract them as the requirement is. Besides this, the final treatment that we sometimes need is medical or an invasive treatment, which means that while doing cystoscopy, certain medications can be injected into the bladder, or if you have a pelvic organ prolapse, then we have to do a surgery to repair the pelvic floor and also sometimes to remove the uterus. So this surgery is called vaginal hysterectomy with pelvic floor repair. In cases of vaginismus, where a woman is unable to have vaginal intercourse, some treatments like physiotherapy, pelvic floor relaxation exercises, vaginal dilators are helpful, and sometimes psychological counseling is also needed. Hope you found this information useful, and if you have any questions, you could put them in a comment box and we will be sure to get back to you. Thank you.